Some of the symptoms would be lower back discomfort, neuropathy, leg pain, sciatica, things that you know that are coming from a vertebra out of place, interfering with nerve supply. Things that will alter the pelvis and the lumbar spine would be anything that changed the weight-bearing capacity in that person. Knee replacement, any type of surgical procedure, hip replacement, fracture of a foot, ankle, knee, leg, anything that would alter the juxtaposition of the pelvis. We diagnose this in the office using the procedures of examination, instrumentation, X-ray analysis. The analysis of the X-ray will give you the mathematics of whether a heel lift is required or not. I have a full spine X-ray here, flat X-ray. The first thing we're going to look for is your femur head line. We're going to mark that and measure it and draw a line. Then we're going to go to the top of the ilium with lines. And then we're going to go to the bottom, ischium. And then we're going to measure these. And we're going to mark the measurements, both the right and the left ilium, pelvis. Then we're going to mark the second sacral tubercle, the sacral notch, and we're going to draw the sacral baseline. Then we're going to use a parallel and draw the fifth lumbar line. And then above that, the fourth lumbar line at the lama-pedicle junction. Now, we're going to measure to the right border of the sacral and right ilium and the left border. This measurement is important. We've marked the second sacral tubercle. We're going to measure the distance to the right and the left. The distance to the right is 70 millimeters. The distance to the left is 58. We're going to come down and we're going to realize we have a mark on the right side, a measurement of 7 millimeters of leg length deficiency on the right side. Here's the position. You got a leg length deficiency of 7 millimeters on the right, you got a rotation of the sacrum on the right, and you have a fifth lumbar that is rotated to the right. Spinous left, body right. Those three items are all on the right side, indicating that a heel lift is necessary in the right shoe. The correction of the fifth lumbar subluxation or the correction of this pelvis will not last until you put a heel lift in that right shoe. If you only have two of these items, you don't need a heel lift. But if you have all three of them lined up on the same side, a heel lift is required on the right shoe for lasting correction of the subluxation you've adjusted.
I was actually experiencing neck pain primarily. I was very, very busy and really did not feel like I had time to be consistently getting the care that I needed. I just continued to experience a lot more pain, and especially in my neck, but then I would notice like in my hips and in my lower back. That brought me into Dr. Galen's office. The Adjust-A-Lift was introduced to me and I thought, sure, I'll try it. What's the big deal really? So I would throw it in my tennis shoe, especially at first when I was just going for walks or runs. And then I kind of realized like, oh, I feel really good when I'm on a walk or I'm on a run. One of the most important things to know about this product is that it's very simple, and it's actually a very simple correction. It doesn't require any procedures. It doesn't require the patient to take any pain medicine. It really is a simple product that you slip in your shoe and you notice a difference. The Adjust-A-Lift worked really well for me when I was wearing it in a tennis shoe for my workouts. Where I started to run into a challenge then is when the seasons transitioned and I really needed something that I could wear in a sandal. And so that's where the ankle sock product really comes into play and can just be a game changer really in the summertime when you want to be able to wear flip-flops or just those summer shoes.
The Adjust-A-Lift helps Tara or any patient because it's a correction. The three different levels, they're all 1/8 inch, so you can adjust that lift to the height that you want just by peeling off the layers you don't need. If you don't use a heel lift, the patient will come back and the adjustment won't last. They'll say it lasted for a while, but then it came back. You've already adjusted the vertebra that's out of place. Now you want to keep it where it belongs. And if a heel lift's necessary, that vertebra will stay in its normal position, therefore providing normal nerve supply for a longer period of time and subsequent relief.